Good afternoon, everyone. So I represent Verilogue as well as our new sister company that we're going to talk about today, which is CareCoach, which is we're really excited about, and hopefully you are too. Not sure if you knew this, but there's 1 billion physician office visits a year in the U.S. alone. So think about that, 1 billion touch points to improve patient outcomes in the U.S. every year. But it's healthcare, so there's also 1 billion terms and 1 billion things that we talk about and all the rhetoric that's out there to confuse us as well. But if you think about it, whether it's accountable care organizations, whether it's the patient-centered medical home, whether it's shared decision-making, there's one central tenet, there's one central theme that's really pervasive through all of that, and that's the doctor-patient relationship, and that's doctor-patient communication. And it's something above everything else when we think about improving access and lowering costs and improving outcomes that we really need to focus on. Oh. I know when I ask my mom about her recent doctor's office visit, she often tells me that that's what the physician sounds like. And we all know that that's a little bit of a embellishment. But what I'm about to show you is a real-life conversation between an oncologist and a patient that's recently diagnosed with breast cancer. And my company, Verilogue, has been studying doctor-patient communication for the last 5 years, and we've got the world's largest corpus of these dialogues across the U.S. and now recently the globe. So go ahead and take a listen to this.
But the PARP inhibitors look like very, very good drugs, but your side effects, they do cause a little bit of neuropathy, numb fingers and toes is the main thing I remember that we watch for. The other thing is this one is a bit inconvenient. You have to come twice a week on like Monday, Thursday, Tuesday, Friday for 2 weeks in a row on the third week, and we give chemotherapy with it.
So it's a little disturbing. Again, this was about 20 seconds of a 12-minute conversation. And not every conversation necessarily sounds like this, but many of them do. So imagine what the other 95% of this office visit sound like. And then imagine that this happens, maybe not 1 billion times a year, but let's say it happens 50% of the time. So 500 million times a year, this is what patients are experiencing in the physician's office. So it's a problem that we need to think about from both the physician's perspective and the patient's perspective. And when you look at it from an analytics perspective, we all know that there's a power imbalance that happens typically between the physician-patient from a role dynamic. It's similar to a parent-child relationship, it's similar to a teacher-student relationship, and it's somewhat magnified in the physician's office, especially when the physician starts speaking in that dense biomedical discourse, whereas patients are typically coming at it from more of a life-world perspective. What you see here is there's a 5-to-1 talk ratio difference, and talk ratio is just the number of turns that each speaker takes. So the physician talks 5 times as much as a patient in these metastatic breast cancer conversations. Now this varies, the talk ratios vary across, we cover about 70 different therapeutic areas, but the physicians always talk more than the patients, except sometimes in neuroscience and in talk therapy, the patients tend to talk a little bit more. But so just again, some stats to think about as we go through how we can improve. So we need to level that playing field, and we also have to look to patients to do more as well. So if you think about the 1 billion opportunities at CareCoach, we like to see that as almost 3 billion touch points. It's not only about what happens in the office visit, but it's how patients prepare for that office visit, how they're activated in that office visit, and then how they follow through on those care instructions. So as you can see here, from a preparation standpoint, only 54% of patients, don't discuss their fears or anxieties with their doctors. And again, if you have these concerns and they're not addressed in your physician's visit, I think that's why we've seen such a proliferation of social media recently, because patients leave their doctor's visit, but they still need to have those concerns addressed. So they turn to great websites like Brian Lowe's Inspire.com, or they turn to other resources like Patients Like Me that are out there to connect in discussion forums with other patients like them. But we're missing, again, 1 billion opportunities within the office visit. When you ask physicians what they'd like to see from patients during these visits, a Consumer Reports study showed that 89% of doctors said that they wish their patients would keep a log or that they would bring someone to the visit with them. But again, only a third of the time patients are actually doing this. And then when you think about the follow-through, again, this has been a challenge that pharma has obviously tackled for the last decade or so, adherence and so forth. Again, patients only remember 50%. As soon as they walk out of that visit, they only remember 50% of what happened during that office conversation. And of the 50% they do remember, they only recall 25% of it accurately. So again, 1 billion times and all the costs that go into all those office visits, and all of us walk out of that visit actually typically on average only recalling 25% of what happened. Again, the part of that study was that over 80% of those patients, when they were polled coming out of the study, they didn't even remember the doctor's name. Right? It's kind of alarming. They didn't even remember, their doctor's first and last name. And over 30% weren't sure what their primary diagnosis was. So again, there's a lot of opportunity to improve doctor-patient communication in the physician's office. We like to call this passive dialogue disorder. And again, if you think about 1 billion office visits and the number of patients that are maybe knowledgeable and empowered when they walk in that office, we don't see them activated in that dialogue. And so our goal and our charge at Verilogue was to create online and mobile tools to help coach patients to be more active and have a more active voice in that physician's office. So what you can see, why are we focusing on this? Well, when you have two-way dialogue and shared decision-making, you have positive outcomes. So patient satisfaction increases, compliance with recommendations increase, general outcomes increase, and you also decrease costs. So again, if you want to attack some of the pervasive outcome issues that we have today, let's stop playing on the periphery and equipping patients with a symptom tracker necessarily, or talk to your doctor guide, and let's give them something to have more of an active voice right in the physician's office. So I want you to think back to that dialogue that you heard. I want you to think about if that was your mother or your wife or your loved one getting that diagnosis right there in the physician's office. So you have all this dense biomedical information coming at you. It's no wonder that patients are overwhelmed. It's no wonder that their emotional needs take them elsewhere during that office visit. It's no wonder that they're not active. Again, I'm not on an equal footing when my doctor or my oncologist starts talking about PARP inhibitors and starts doing it in such a fast manner. Even if I had read about PARP inhibitors before coming into that visit, I'm not going to necessarily challenge him or have the guts, let's say, to pull out my paper right there and start asking some questions. And then there's poor recall. So it's no wonder that even though I asked my mom, hey, Mom, how did your office visit go with your doctor? I feel like when I ask her that sometimes, it's like asking my child how their day was at school. You get a very nonchalant type of answer. So what's the solution? There's a lot of work that we have to do, but we think that you should take a look at Care Coach. What Care Coach does is it allows people to connect remotely through a mobile resource, whether I'm in Philly and my mom's in Florida, through an online suite of mobile and coaching tools. So this is a screenshot of our homepage, and as you can see here, if you go to www.carecoach.com, for the first time you have the ability to listen to other patients like you. And so there's an opportunity, like we said before, to go out and talk to other patients like you, but you've never been able to actually hear office conversations of patients like you. And so we give the patients that unique ability to go in and listen to, for example, breast cancer, about 16 different active therapeutic areas right now, and we've highlighted different points in that patient's journey to listen to patients like them. So if I'm newly diagnosed with breast cancer, I'm able to go on to the Care Coach site and actually listen to the first initial diagnosis conversation of other patients like me. And more importantly, not only can I listen, but we've mined out the top 10 questions that patients ask their oncologist during this point in the treatment journey. And also, we've mined out the top 10 questions that doctors, the oncologist, is likely to ask of mom during that visit as well. So it's a very powerful resource to get prepared to kind of, instead of not expecting what's going on, to equip yourself and be a little bit more empowered. Now, when I said before, we want to take it from empowerment to activation, well, it's great to have these question lists, and there's a number of resources out there today that provide top 10 questions, but it's about giving those questions to you right when you need it most. So when I walk into I actually don't have my mobile phone on me. When I walk into the physician's office, I need that personal digital advocate right there with me. I don't need a handout necessarily. I need something in my tool to not only help me ask the questions that I want, but to also record that visit. Like we said, recall was a big problem. So for example, not only can my mom ask the care coach, what are 5 questions that I ask, but myself and my sister in Denver can also enter questions into the system that we want mom to ask the oncologist as well. All the meanwhile, we're recording this visit, and we're tagging these questions as we ask them, allowing playback whenever, wherever we need it. So again, fast forward to the next time I ask mom, so mom, how did your visit with the oncologist go today? And she'll say to me, well, you should know, Jeff. Just go ahead and listen to it on Care Coach. And so what this allows us to do, again, is to bring our care team together. So not only are we working on shared decision-making and activating patients right there in the exam room, but we're working on care coordination, another big area of healthcare. When patients walk out of that office visit and they only accurately recall 25% of what happened, Care Coach gives them that digital advocate to go back anytime, anywhere, and listen to that full dialogue, as well as members of their care team. So I'd like everyone to go to our website and download the mobile app, and hopefully next time you go into a visit, you'll be using our audio health recorder. Thank you.
You can just sit there, I'll take that. Great, that's powerful stuff. We'll get a chance to ask Jeff some questions in just a couple of minutes.